Our next speaker is Xiaolei Xu on behalf of Congcong Li. She's from the University of Electronic Science and Technology of China and will be talking about disorder and emotional context-specific neurofunctional alterations during inhibitory control in generalized anxiety disorder. The stage is yours. Thank you very much.
Thank you, Ellie. Hello there. This work was mainly contributed by Congcong Liu. However, she just got a surgery, so I'm here on behalf of her to give this talk. Our research was supervised by Professor Benjamin Baker. The title of our talk is Disorder and Emotional Context-Specific Neurofunctional Alterations During Inhibitory Control in Generalized Anxiety Disorder and Major Depressive Disorder. As we know, GAD and MDD are among the most prevalent and devastating disorders, and comorbidity represents normative clinical course. In fact, more than 58% of GAD patients are also comorbid with depression. And on the symptomatic level, both disorders are characterized by several common symptoms like sleep disturbance and concentration difficulty. Since both disorders are highly comorbid and there are so much overlap in symptoms, how can we distinguish them with the help of neuroimaging technology? One recent study used a Emcee task found that only MDD patients showed alterations in right dorsal anterior insula and its communication with the amygdala, but GAD patients didn't have these alterations. But however, when experiencing physical pain, both disorders has common alterations in the MPFC. One earlier fMRI study using emotional conflict task also found that GAD and MDD showed common alterations in ventral cingulate and right amygdala. Except the Emcee and emotion regulation just mentioned, MDD patients was also found deficits in emotional context-specific control, which may represent potential behavioral and neurobiological markers for MDD. However, previous studies in this domain rarely considered the medication, duration of disease, and relapse. All these influences. And also for GAD patients, research on this domain are still scarce and revealed inconsistent findings. So our present study aims to determine disorder-specific alterations in the domain of emotion, cognition, interactions, recruiting treatment-naive first episode MDD and GAD patients compared to healthy controls by employing a validated effective go-no-go fMRI task. In this study, we not only considered the medication, duration of disease, and relapse, we also excluded those participants who comorbid with PTSD, mania, OCD like this. So the final, based on our exclusion criteria, the final sample size for analysis included 26 GAD, 34 healthy control, and 30 MDD. The effective linguistic go-no-go paradigm was a fMRI paradigm. It was a mixed event-related block design, which included 12 blocks per round and 2 rounds in total. There are 6 conditions in this study. neutral go, neutral no go, negative go, negative no go, positive go, and positive no go. At the beginning of each block, participants were instructed to press the one button if the upcoming words was normal font. Otherwise, they don't need to press any button. To explore distinct dysregulations in the interaction between emotion and inhibitory control between different categories, the following contrast of interest was subjected to analysis. For negative valence, we use negative versus neutral times no-go versus go. And for positive valence, we use the positive versus neutral times no-go versus go. We use a whole brain level, cluster level FWE correction for our analysis. Here comes the results. This is our demographic information. There were no significant differences between groups in gender, age, and education. But for anxiety, depression, and early life stress scores, there were significant differences in 3 groups as we expected. On the behavioral level, MDD patients exhibited less accuracy to no-go trials. That means they made more errors to inhibit their, to control their finger to press the button. On the neural level, there were no significant differences in positive context. However, for negative context, there was a mean effects of group. And the post-hoc analysis found that MDD patients showed decreased activation in left and right postcentral gyrus and middle cingulate. And post-hoc comparison of the 3 groups confirms that MDD showed decreased activation in these regions compared to healthy control and the GAD groups, which indicated that the interaction effect was driven by altered neural activation in the MDD patients. When directly compare GAD and MDD groups, we additionally find that a significant increased recruitment of the left dorsolateral prefrontal cortex in the GAD relative to MDD patients. And to further distinguish the complex interaction effect and to determine alterations during inhibitory control in negative contexts, an additional voxel-wise ANOVA focused on the corresponding contrast, negative no-go versus neutral no-go was further analyzed. And we found the same results as I described before, that MDD patients showed decreased activations in those regions compared to both healthy control and GAD patients. The behavioral analysis I showed before has already revealed that GAD patients exhibited preserved inhibition control in the context of negative emotion and exhibited increased DLPFC recruitment in a direct comparison with MDD patients. This may suggest a compensatory mechanism which may facilitate intact response inhibition in GAD patients. So to explore this hypothesis, we employed a voxel-wise regression model to examine associations between accuracy rates for negative no-go trials with whole brain activation in the corresponding contrast within GAD groups. Results reveal that within the GAD group, better inhibitory control in negative contexts was associated with increasing activation in the left DLPFC. These findings may, however, no such correlation was found in healthy control and MDD patients. So these findings may reflect that GAD patients can maintain inhibitory control in negative contexts via compensatory recruitment of the LPFC. In conclusion, on behavioral level, MDD patients, but not GAD, exhibited impaired inhibitory control irrespective of emotional contexts. And on the neural level, no alterations were observed during positive contexts, yet specifically MDD patients demonstrated attenuated recruitment of a broad bilateral network during inhibitory control in the negative context. GAD patients exhibited stronger engagement of the left DMPFC called the DMPFC related to MDD patients. And within the GAD group, better inhibitory control in negative contexts was associated with higher recruitment of this reason. So findings from the present study suggest the disorder and emotional context specific behavioral and neurofunctional deficits in inhibitory control in MDD in negative emotional contexts and may point to a depression-specific neuropathology and diagnostic marker. In contrast, GAD patients may maintain intact inhibitory performance while compensatory recruitment of prefrontal regions. This is our GAD and MDD research team leading by Professor Benjamin Becker and Professor Keith Kendrick. Thank you for your attention, and more details can be found from our preprint. Your comments and questions are welcome. Thank you.
Thank you very much, and thank you for your awesome timekeeping as well. We already have a question here in the Q&A panel. Lucy, I will be allowing you to talk, so you can unmute yourself to answer, to ask your question. But if you want me to ask as well, I can do that. Lucy, no, she's able to unmute herself, but I'll take that as a sign for me to read it. Lucy says, nice study. Could the paradigm be applied to the clinical diagnosis or determination of MDD versus GAD?
Thank you for the question, Lucy. Actually, that is our aim to apply our technology to diagnostic in the future, but now I think it's very difficult to apply this this paradigm to clinical diagnosis because this result is from a group level analysis, and but diagnosis is more individual level. So in the future, I think we need more precious design and study to examine the individual differences in neuromechanisms. And this study is very basic research to explore the neuromechanisms in cognitive control.
Thank you very much. For the next question, Rosaba, you'd be able to unmute yourself if you want to ask a question yourself.
Yes. Can you hear me?
Yes, absolutely.
Okay, so thank you so much for your talk. I don't know if I understood correctly, but it seems like in the different group that you use, all the subjects were male. You didn't decide to include the females, and if yes, why?
Thank you for your question. Actually, we involved females. You can see from the table that in total, there are 26 GAD patients. But here we give the number of males. The number of male is 14, so female it is 12. So in this study, we included both male and female, but there's no gender differences between groups.
Thank you very much. I have a question myself as well, which is, it seems that you don't really find any differences between generalized anxiety disorder and healthy controls. So I wonder how you come to the conclusion that your population with generalized anxiety disorder is using compensatory mechanisms.
Oh, that is because also for the behavioral level, we didn't find the differences between GAD and the healthy control. But for the from the neural level, when we directly compare GAD and MDD, actually we compared the post-hoc analysis compared healthy control and MDD, healthy control and GAD, and GAD and MDD. And we found that although there's no difference between GAD and healthy control, but when we compare GAD and MDD here, we found an increased activation in the DLPFC. So when we compare these two disorders, we found this DLPFC. So we think that the reason that GAD didn't show alterations in both behavioral and neurobiological, maybe it is because the DLPFC has already worked as a compensatory mechanism.
Yeah, I just wonder why you wouldn't just conclude what's way more obvious, that there may not be an impairment in that particular task in people with GAD.
Actually, this
because a compensatory activation, you would assume that they would have more activation than the healthy controls, right? Because that's a relevant comparison.
Yes, actually, we didn't find that. It's just compared to MDD. It's not compared to healthy control, because both behavioral and neurological, there's no difference between GAD and MDD, GAD and healthy control. But compared to MDD, GAD may benefit from the DLPFC.
Thank you very much. That's really interesting.
Thank you.
Moving on to our last speaker, who is